I would say to patients and caregivers who are feeling uneasy about gene therapy that I understand. First and foremost, it is complicated scientifically to understand unless you get the right person to sit down and go over it with you. In fact, it's far easier to understand than some of the other things that we ask patients and their caregivers to consent to doing, quite honestly. And it's not that different from bone marrow transplant, which I think a lot of people conceptually have begun to understand at this point. So we need to do better as a medical community in choosing the right words and the right explanations. But that said, I understand the hesitation. And I would say that as a clinician myself, I have some hesitation about gene therapy, and it's not because of the therapy in and of itself, but some of the side effects that can come about as a consequence of undergoing gene therapy. First and foremost, it can cause infertility, and that's a major side effect that patients and in some cases parents of affected children have to consider very strongly. Is it worth giving up your future reproductive choices? And then there are some current concerns in the long run about possibly having secondary cancers develop, particularly bone marrow cancers that could develop as a consequence of getting this type of treatment. But you know, we're very early in the gene therapy clinical trial investigations. The data look very, very strong. There are a lot of strategies being employed right now, and I think that these questions about safety and reproductive effects will emerge over time. And so I remain incredibly hopeful, and I think people out there who are listening should also feel the same, but they should be asking the critical questions.